Thank you for introducing. I'm Dr. Jin Woo An from South Korea, but actually I work in Dubai for 3 years. I'm so honored to present here some topic about UBE and really appreciate inviting us. So my topic is about UBE, but not technically. It's like some history, some like a story. So welcome to UBE world. Yesterday I joined to the cardiac workshop. There are many Indian doctors. They have some passions and try to run actually. So very impressive to me. So just I talk about UBE history. There is some history in spine surgery. Spine surgery has changed a lot over the past decade. It cannot be compared to the past and continue to evolve. So in 2016, the term bipolar and UBE introduced first in the article published in Korea. The first doctor introduced some bipolar technique is the Dr. Anthony from Argentina. He published some first technical note about the bipolar using some instrument inserted independently through the two portals. But this technique is just to stay and not spread, not developed. And only the position is lateral, and only the lateral and adopted only simple disc herniation. So the next doctor, maybe as you know about Dr. Abdul Ghaffar from Bahrain, he presented some article, lumbar disc excision by midline epidural endoscope, the 68 AAOS in 2001. So this presentation is very impressive to two Korean doctors. Because of that, 2002 Korean doctors, orthopedic surgeon, Dr. Young Chol Choi, he visited Dr. Abdul Ghaffar 2002 and began implementing this technique with Dr. Jin Woo An for the first time in South Korea. And next doctor is the 2003, Dr. Jin Woo An presented an article, endoscopic lumbar discectomy for parietal disc herniation with bipolar technique. So he presented post biennial Korea-Japan conference in Japan. So next doctor is the Dr. Sang-Gyu Son. He presented 2013 the unilateral bipolar endoscopic segmental sublaminoplasty for the lumbar central stenosis at the International Society Minimal Invasive Spine Surgery in Japan also. Same year, Dr. Sang-Gyu Son presented the endoscopic unilateral laminectomy and bilateral decompression, the ULBD technique, and foraminotomy and fusion using UBE. This is the starting point of the UBE spread all over the world, I think. And so, especially in Korea, UBE is very special in Korea because of the UBE is developed in Korea and spread from Korea. So since 2002, independent trial and research of UBE have been conducted and full-scale presentation of research result and the related workshop have been held since 2013. Increased experience of the endoscopic spine surgeon with UBE has led to the explosion of innovation, mainly in Korea. So as a result, Korean surgeons were able to apply UBE technique to various pathology, such as thoracic, ossified yellow ligament, and the cervical approach. Especially cervical approach is considered challenging, as well as relatively common applications, such as lumbar spinal stenosis, parietal disc herniation, maybe recurrent disc herniation, discitis, and abscess. The bipolar approach, as a result, Korean surgeons are able to apply the UBE technique and with bipolar approach, also enabled to end plate preparation and foraminal decompression under direct visualization, which is vital for the lumbar interbody fusions. All major UBE-related papers since 2016 have been published in Korea, which are attributed to Korea's inventory history of the UBE. Since 2018, many foreign doctors have visited Korea to observe and learn about UBE. The unique history of the UBE in Korea included the background that led to various research achievements. So finally, early this year, we make some post-UBE textbook by the Korean doctors, mainly Dr. Chol Bak and Dr. Dong Ho, who published this textbook. I think this textbook will be some useful guide for the UBE surgeon. And now currently, the UBE surgery being performed all over the world, Spain, United States, Australia, Algeria, China, India, Middle East. So nowadays, UBE is a very hot issue. And after Korea UBE Society in 2017 named the World UBE Society, UBE Society has been created in many countries, India also. There is a very positive situation. I think there will be more development in the future. So I expect the UBE, future of UBE, the indication spectrum of UBE is very wide, and I think all spine diseases we can cover by the UBE surgery. So next is just I present about UBE basic concept. This UBE surgery is kind of the arthroscopic surgery based on arthroscopic surgery in joint. But unlike the joint surgery, spine doesn't have any working space. This is different point. So important thing is the first one is the targeting and skin incisions. The left picture shows the interlaminar approach, and right picture shows the paraspinal approach. It's the same thing, the uniportal approach also, but the target point in the interlaminar approach is the kind of spinolaminar junction usually, and paraspinal, for the paraspinal target point is kind of transverse and laminar junction. The next thing is the UBE is the art of the water flow. The water flow is very important. You must care, and during surgery, water flow is well managed. That is point of the surgery. The well-controlled, continuous outflow can make an optimal hydrostatic pressure and make surgery easy. Oh, sorry. You can see the water flow. Outflow is very important. So video shows the outflow is very important. So you have to check inflow and outflow during surgery. Keep the pressure 30 to 50 millimeter mercury for the surgery. So next video. This is the control of the water flow. The control of the water flow that makes some breathing focus we can find. And sometimes we can make more working space with the pressure control. So first one, we can, so we can see the blocked water flow. We can see the bleeding focus slowly. And second thing is just the pressure control. We can make more space for the working. And next one is the triangulation. This is very important. You know, the triangulation, the beginner, the best region of the failure of the UBE surgery. That means the scope and the instrument and must meet in the target point. Sometimes open or early triangle that make a surgery difficult. So this is the triangulation video. The first time, just to see the like a red screen. But if you make a triangulation exactly, you can see the instrument in the screen. So next things about the manipulation of the ligament problem. Usually you remove the ligament problem. Just using the blunt instrument is better. Sometimes to remove the ligament problem, the dural injury can be happen. So gently split the ligament problem and just remove the ligament problem is best way, like a peel out like that. And if possible, the Harrison Longe using must be careful. And the touch the dura, that make a nerve injury, and if possible, reduce the dural touching. That is the point of view. So UBE, the UBE surgeon, the scope can move freely. So you can search all sides, the move, that is very flexible. So sometimes you can make some wrong portal, but don't be afraid. You can manage and correct the locations and without any new portal. That is very flexible. So what can we do UBE? I think all disc disease and all degenerative disease, we can manage that. Even fusion and even other problem in spine. So I showed some small tips. The careful review the patient information, and you can decide which approach you will do. And important thing is accurate targeting. Targeting is very important. I think UBE is powerful surgical method and more safe than open surgery. And I think endoscopic surgery, including UBE, will be standard treatment in the spine surgery. Thank you for your attention.